Did you know that over 18 million people die every year worldwide from cardiovascular diseases? That equals one death every 2 seconds. And the scariest part is that most of these deaths could have been prevented. Because many of these people ignored the signs their bodies were already giving them. The problem is that the signs of a heart attack aren't always obvious. They don't always come with chest pain or intense pressure. Often, the warnings come in strange, subtle ways, easily confused with everyday issues. And that's exactly why in this video, you'll discover 11 unusual signs that may indicate an impending heart attack, signs many people ignore, but that you'll learn to recognize in time. Stay until the end, because the last symptom has even fooled healthcare professionals. Extreme fatigue is the first sign you need to pay attention to. But it's not just any tiredness. We're talking about that exhaustion that appears out of nowhere even after a full night's sleep. You wake up and feel like you have no energy at all. Climbing a flight of stairs feels impossible. Walking short distances leaves you breathless. Doing simple everyday tasks, like washing dishes or getting dressed, already takes a lot of effort. Many people blame this on stress, work, or age, but when your body is this drained without an apparent reason, it could be a serious warning. This type of fatigue happens when the heart is already working at its limit and can no longer pump enough oxygen to the body. The feeling of heaviness, slowness, and weakness is your body's way of telling you that something is wrong. Ignoring this sign can be costly. In many cases, it appears days before a heart attack. Another sign that few people associate with the heart is pain in the jaw, neck, or left shoulder. This pain often comes without warning and can show up as mild discomfort or more intense, like a stab or tightness. Most people think it's muscular, poor posture, or even a dental issue. But the explanation lies in the nervous system. The heart shares nerve connections with these regions, so when something is wrong with the heart, the pain can radiate to unusual places. Especially in the shoulders and jaw, the pain can be misleading. It can come and go, change in intensity, or get worse over time. In women, it's even more common for a heart attack to present this way. If this pain is accompanied by malaise, fatigue, or cold sweat, seek help immediately. Don't underestimate discomfort just because it's not in your chest. The third sign is one of the most dangerous because it mimics a very common problem: indigestion. Many people feel that burning sensation in the stomach, that heartburn or reflux feeling, and believe it's just poor diet or something they ate. But in some cases, this may be your body trying to alert you to something far more serious. A heart attack, especially in older people or those with risk factors, can present as mild abdominal pain, pressure in the upper stomach, or even unexplained nausea. This type of pain is often ignored or treated with antacids. The problem is that by relieving the symptom with medication, the person masks what's really happening. And that delays the decision to seek medical help. If this indigestion comes with sweating, back pain, dizziness, or fatigue, don't wait. It may be a warning from the heart. One of the most ignored but extremely dangerous signs is sudden dizziness or even fainting. You're walking normally, and suddenly the world spins. Your vision darkens, balance disappears, and you feel like you're going to fall. In some cases, people actually pass out. This can happen because the heart isn't pumping enough blood to the brain. Blood pressure drops suddenly, and the body goes into protection mode. This is not something to ignore, especially if it's new or has no clear cause. Many times, it's mistaken for dehydration or just a passing illness. But it can be a sign that the heart is failing. If you've experienced something like this, especially if it came with weakness, mental confusion, or cold sweat, seek care immediately. It's the kind of symptom that can precede a serious cardiac event. Now pay close attention. Feeling short of breath while at rest may be one of the most dangerous signs that your heart is in trouble. Imagine being seated or lying down, doing nothing, and still feeling breathless as if you had just run up a hill. This happens because when the heart can't pump blood effectively, the lungs suffer. Oxygen stops circulating properly, and the body responds with rapid breathing and chest discomfort. This shortness of breath doesn't have a logical explanation at first glance, and that's why it's so often overlooked. Many people think it's anxiety or a mild cold. But when there's no apparent cause and the symptom repeats, the origin may be the heart. That's the moment to seek help, because in situations like this, every minute of delay can add to the risk. Now let's talk about one of the sneakiest and most easily ignored signs: sudden cold sweat. You're standing still in a calm environment, not hot, not exercising, and suddenly you start sweating as if you ran a marathon. This sweat is cold, clammy, and usually comes with a feeling of weakness, nausea, or even a sense of imminent death. This happens because the body goes into shock, trying to respond to an internal collapse. It's one of the classic signs of a heart attack, but also one of the most ignored. Many people think it's just nerves, anxiety, or even a blood pressure spike. But when the sweat comes out of nowhere, in a context that doesn't make sense, it should be treated as a serious warning. Especially if it comes with other symptoms like pain, dizziness, or shortness of breath. There's a seventh sign that almost no one links to the heart: a sudden sense of anxiety for no apparent reason. Imagine being fine, calm, and suddenly feeling your heart race, a tightness in the chest, a general discomfort, like something bad is about to happen. In many cases, this is mistaken for a panic or anxiety attack. But what few people know is that a heart attack can indeed cause the sensation even before the pain or other physical symptoms appear. This happens because, in moments of impending heart failure, the nervous system reacts with a spike in adrenaline and stress, trying to compensate for poor circulation. The result is a sudden feeling of restlessness, fear, or extreme nervousness. If you've never suffered from anxiety and suddenly start having these sensations intensely and frequently, with no emotional or psychological cause, it's worth investigating. It's not always psychological. Sometimes your body is warning you that the problem is physical and more serious than it seems. Another silent and rarely mentioned sign is swelling in the legs, ankles, and feet, also known as peripheral edema. This swelling happens because when the heart starts to weaken, it can't pump blood efficiently. This causes fluid to build up in the extremities, especially in the lower parts of the body. At first glance, it might look like fluid retention or poor circulation. But if the swelling is recurring, especially at the end of the day, and comes with a feeling of heaviness in the legs or difficulty putting on shoes, pay attention. This could be an early-stage sign of heart failure. The body is showing that internal pressure is building up and the heart is struggling to meet demand. Many people treat it with diuretics without investigating the cause and end up masking the real problem. If you notice this kind of frequent swelling, it's best to see a cardiologist for a detailed evaluation. The ninth sign is something very subtle, but that can indicate the body is on alert: changes in heart rhythm, especially mild arrhythmias that come and go. The heart may start beating faster for no reason, skip beats, or even feel like it's fluttering in the chest. Many people feel this and ignore it, thinking it's just nerves. But these changes, called palpitations, can be signs that the heart is having trouble maintaining its normal pumping rhythm. This can happen days or even weeks before a heart attack. And the most dangerous part, in some cases, the patient doesn't even notice and only finds out after an electrocardiogram. That's why it's important to observe any irregularity in your heartbeat, especially if it comes with dizziness, weakness, or chest pain. The heart has its own language. When it starts to express itself with rhythm failures, it's because something demands attention, and ignoring it can be costly. Another uncommon symptom that deserves attention is back pain, especially in the upper part, between the shoulder blades. This pain may seem like muscle tension, fatigue, or even poor posture, but in many cases, it's the heart crying for help. What happens is that a heart attack can cause referred pain. That is, the brain interprets the signal from the heart as coming from another part of the body. And the area between the shoulders is one of the most common for this type of confusion. This pain is usually continuous, deep, and often doesn't go away with rest or massage. In women, this is one of the most reported symptoms before silent heart attacks. If this pain comes with other signs like nausea, cold sweat, or fatigue, don't wait for it to pass. It may not be muscular. It could be the heart showing itself in disguise, and the only chance to avoid the worst is to recognize it in time. And finally, an 11th sign that deserves attention: difficulty sleeping or a feeling of shortness of breath when lying down. Many people report that when they lie down, they feel chest pressure, shortness of breath, or even an anxiety that forces them to sit up to breathe better. This can be mistaken for anxiety or common insomnia, but in reality, it may indicate that the heart is struggling to pump blood efficiently while the body is at rest. Lying down causes blood to redistribute differently, requiring more effort from the heart, and when it's compromised, this shows up as discomfort or even nighttime breathing crises. If you feel that you can't sleep well because of your breathing, or wake up with a racing heart, don't ignore it. This type of symptom can be a silent warning of heart failure. And the sooner you investigate, the greater your chances of treating it in time. Now that you know the 11 strange signs your body can send before a heart attack, it's clear how important it is to pay attention. Your body speaks. It warns. It screams, but not always in the way you expect. And if you ignore these signs, you might be missing the only chance to act in time. Many lives are cut short every day because of small signs that were ignored. But yours doesn't have to be one of them. If you recognized any of these symptoms in yourself or someone close, share this video now. It can make all the difference. And if you want to keep learning how to interpret your body's signals clearly, subscribe to the channel, turn on notifications, and stay with us. What you learn today can save your life tomorrow.